my name is Dr. Tangi Gilliam, and I'm the Director of Community Revitalization at the Trenton Housing Authority. It gives me an enormous amount of pride to speak to new initiatives that we have developed in our Community Revitalization Department in order to advance the quality of life for Trenton Housing Authority residents and really for city residents at large. One of the programs is Rubber Roads. That's our workforce development program. And as a companion piece, a very important companion piece to the Rubber Roads project, we have initiated Pulse, which is our public health program directed by Dr. Jennifer Warren, Vice Chair and Commissioner Warren, as well as a public health professional out of Rutgers University. We're excited by the opportunity to continue to foster an education pipeline where our residents are getting mentored and trained within their respective fields to do the kind of important community work of community revitalization.
Public health has now taken a closer eye to community level health, and that is really trying to look at local level determinants of health that impact people's behavior, their perceptions, their access to care, the quality of care, and now we have these new words like determinants, like social determinants, for instance. While these social determinants are definitely at the population level, when we think about the have and the have-nots and community level health, social determinants play a huge role in the type of care or understanding of care that that individuals and organizations even have.
My name is Mona Hariri. I'm working with Dr. Warren on the Assistant Medical Review. I'm studying health systems and policy, working on my master's in public health.
Hello, my name is Saraman. I'm an MD from India. I'm here doing my MPH program in epidemiology, and I'm working on my thesis right now. I thought that working with Dr. Warren in this project would be fascinating because I'm interested in community outreach of underserved communities. And I saw the email about a semester and a half ago, actually 2 semesters ago now, telling us about communication processes and how they affect health outcomes. And I was interested, so that's why I'm hooked on this project right now.
And culture plays a huge role. And I know I've gotten pushback on this time and time again, but when we're talking about people living in an urban environment, there's a certain mentality and way of understanding life that is quite different than living in a suburban area or a high-end area. And I say pushback because people don't like to hear that there's like a working class or lower income type of culture because it sounds classist, racist, because they know many people living in these environments are of color, but there are. I mean, people have gotten strategies and ways to be resilient.
We have tables here, exercise area here. We have a nurse that comes in to do our blood pressure, check our weight, tell us how healthy we are, and then we just have a program.
Encoded is a communication term, and that means they encoded collaboration through researchers. Well, equality was in collaboration was encoded through researchers and community as a whole, determining information channels, information types like the products, determining audience, and design features of message. That is striving to do just that, engage communities, urban inner city communities, with the Trenton Housing Authority as sort of the test kitchen around these technologies. Not only that, but we're doing a mobile-enabled version of this motivational site, and we're also thinking about throwing some kiosks in there so that they have another way to access this information. So this is all sort of an exploration around what will work in a community health way that draws upon population level health data, right? So my goal is to challenge those data, and with Dr. Gilliam and Herb Brown from the director and the commissioners and everybody else who's involved in really sort of building an infrastructure, because we need the people at the top to be able to build the infrastructure. We're hoping that this might be effective and that we may be able to integrate this as an ongoing piece within Trenton Housing Authority, but also once we show how effective it is, that other housing authorities will want to jump on our bandwagon.